Hi there, my name is Judy Streit, and I'm the Program Director for Infectious Disease at the University of Iowa Hospitals and Clinics, and also currently serving as the Interim Division Director. So in these roles together, I think I have some experience and a good perspective on what our program offers people, especially in the realm of scholarship and research. So having done this job for a number of years, the program directorship, I can look at the number of candidates who've come through our system whom I've interviewed, and there are some recurring themes in what gets these young candidates excited about their training. And the things that I would say about them is that they're curious, that they're problem solvers, they like to think deeply and broadly about patients and about other issues, clinical or otherwise. And these qualities make for scholars, for future scholars. And when I use that term scholars, I'm referring to people who enjoy building new knowledge through inquiry, who are interested in developing new skills and then applying these skills, testing them, teaching them. So if I take a step back and refer to the big picture of us as people who train ID fellows, is that we want any trainee to become our colleague who's an ID expert and a highly valued consultant, and as part of that to become a competent antimicrobial steward and also to understand the principles of infection prevention. But a second large goal is that any trainee should become a scholar, and by that I mean they become a lifelong learner, a critical thinker, they're able to apply new findings to their work. And the scholarly work of fellowship, I believe, is important for anyone who trains in infectious disease. At the University of Iowa, I think we're especially equipped to have our graduates blossom in this regard. There's a legacy of collaboration for research within the internal medicine department and between our division and other departments. And if we first look at our ID faculty, we have among them outstanding researchers with a track record that's terrific regarding productivity and innovation. And some of the divisions or departments with whom we have deep collaborations are the departments of microbiology and immunology, areas of clinical microbiology within the hospital and the pathology department, the College of Public Health, the Program of Hospital Epidemiology and Infection Prevention, as well as the VA Research Consortium in Health Services Research. So if we talk some about the logistics of the scholarly work and how that happens and when that happens, during the first and second year of fellowship, the fellows typically spend about 9 months in scholarly work, predominantly in their second year. But what about those trainees who have a goal of an academic career? I can look back and point to a number of graduates who've completed a number of programs that we have available for more extended training, and they have gone on to become faculty either at the University of Iowa or in other academic programs. And the mechanisms for these third and fourth years are several. They include T32 training grants in infectious disease, and in addition to these trainees having available to them opportunities for basic science research, they can also be involved in quality improvement projects or in health services research and be eligible for T32 grant support. So in addition to that, there are several programs available for our trainees through the VA, and opportunities there include participation in the VA Quality Scholars Program, and we've had several graduates who've spent third and fourth years doing research in health services research, antimicrobial stewardship, and also achieving their master's degree, whether in Masters of Public Health or in Masters of Clinical Investigation. There's also a new opportunity for our trainees at the VA as Health Services Research Fellows, and there's also at the University of Iowa a parasitism training grant, which provides opportunity in global health research as well as opportunities for global health experiences. And I'd like to also comment on some other opportunities for research or scholarly work that would include opportunities during years 1 and 2. And that would include opportunities in computational epidemiology, working with some of our faculty in that area. We have faculty who are engaged in research in health equity and infectious disease. We have a large vaccine research trials unit, so opportunities in vaccinology. And then also projects that are going on in telehealth telehealth, such as in statewide teleprep programs and other mechanisms to provide delivery of care in rural areas. And there are people involved in research in medical education as well. So I could go on. I think it's important to let you know that we'd love for you to look at our website where the background information on our faculty is listed, as well as additional training opportunities in research. So thank you for this opportunity. I'm excited to meet some of you this fall in the interviews, and I wish you well as you engage in this hunt for your next stage of your career.